have your agenda before you if you'd like to take a look at that and see if you have any questions or anything you think needs to be added.
This is the minutes of the last meeting.
We do have the minutes from the last meeting, but there's an agenda as well, Mr. Riley. Do you have a paper that looks like this?
No, I don't have that.
Okay, we
Yeah.
can keep
Do
that.
you have an agenda? We'll pass you one. Does everybody else have the agenda? Okay.
I'll move
I'll
without the
motion that
agenda.
we adopt the agenda.
All right. Is there any discussion about it? Everybody get a chance to look at it?
I
Okay, you
think we
move.
both spoke at the same time, so maybe the second
Okay.
could be the first.
Okay, thank you, Mr. Rayleigh. So we'll adopt the agenda as it is. And if you'll look at the minutes from the last meeting on August 17th and see if there are any changes to be made.
Move we approve the meetings. And I ain't got no sense to that.
I'll motion
I
we
mean, yeah, approve the minutes.
accept the
All right.
Fits for the
August
meeting.
17th meeting.
Okay, thank you. Sharon, did you get that?
Yes, ma'am.
Okay, do we have anyone for public comment tonight? No? So we'll go ahead and start with the administrative reports. I think Tim's up first with the financial update. He is virtual, and so you have his handout in your packet. Tim, are you ready to start?
Yes, ma'am.
All right.
Okay, good afternoon, good evening. This is the financial update as of September 30th, 2021. This is through the first quarter of the fiscal year. Our current operating budget is at $809,741, which is at 20.6%. So we're a little under budget. As a normal quarter, 25% should be used. So we're currently under budget. We'll draw your attention to the two highlighted lines. The administration line, mainly because that is the line item that when the county cuts the budget, they cut the administration line. So that is the reason why that's above budget. And the immunization line, we've had to purchase a bunch of different immunizations, private, as well as the fact that normally we have one or two rabies cases a year, and I think we've had probably 7 or 8 this year. So the rabies vaccine is very expensive, and it was not budgeted for. So that's why that number is increased.
Okay.
Any questions? Okay.
Yeah, go ahead. I don't think so.
I'm sorry.
I said, I don't think we have any questions. Thank you.
Thank you. The next screen will be the revenue collections. I will draw your attention also to 17.1%. We are under collections at this time. Also, the ones that you see highlighted in yellow, those are clinical services that are currently being provided by our clinics. However, due to fiscal management being short 2 staff members, billing is currently behind. So those numbers look bad, but they're going to increase as soon as I get someone in to help assist with billing those medical visits. Any questions? Okay, if not, the last screen, this is just an overview from what has been the past 3 years and where we are now compared to where we have been this time of year. As you can see, the numbers are down because once again, the billing is behind and has not been sent off. However, I will note also that we are having a few issues with the Medicaid managed care plans. So we're still working out through some of the kinks of those as well.
Is that because of the new Medicaid plans?
Yes, ma'am. There's now 5 different Medicaid brands or Medicaid companies, and it's a learning experience.
So do you anticipate with billing that everything will be back up to par?
Yes, ma'am. I'm fairly confident by your next meeting, you should see these numbers increase.
Okay, thank you.
Any questions on the finance report?
I don't think so, Tim. Thank you very much.
Thank you, Madam Chairman. I do ask, is it possible if I be excused for the rest of the meeting?
Yes, it is, and thank you so much for your help.
All right, thank you.
So we have up next the monthly activity summary, and you have that handout in your packet. Is anyone going to present anything from here?
Not that I'm aware of,
Okay,
other than, if Dr. Eli or Donna, I know Donna's on, if they want to present their information.
so we've got the packet before us. Is there anything that anybody who contributed to the activities this month, is there anything in particular anybody would like to talk about? Donna or Kathy or Eli?
Not me.
Yeah, that's fine. I think those are just,
I got a question for you.
So why don't you just look through it and see if you have any questions for anybody there. Most of them I think are on, if there are any specific questions. Donna, are you still there?
I am.
Do you want to comment on what you're doing down at the American Legion site?
We still are doing vaccinations and also doing testing. And they're now doing rapid testing at the site. Initially, it was just PCR send out. Now it's also rapid. It's just the testing piece of it slowing down over there. But Scotland Health actually requested Optum to set up a site at the hospital to test people who were just there as asymptomatic, either need a negative for whatever reason or they've been exposed. So we actually worked it out where those people, instead of Scotland Health having a whole new site of the same group, they refer those people over to the Legion site to be tested, and that way the urgent care can take care of the people who come in that are symptomatic and actually, are more in need of an urgent service. So that worked out pretty good. But, so hopefully that, I think, once testing slows down, I'm not sure, but I sort of get an idea that if it slows down to a crawl, that they may recommend pulling out. The vaccines, they're doing pretty good. They probably average about 10 vaccines a day over a 5-day period. So they're actually giving more than we are at this point. Yeah, that's about all I can say about that for now.
Okay, sounds good. Has everybody seen where they're set up down at the American Legion? Have you driven by on Atkinson Street to see?
Could I ask, what did she say about the number of persons that average get in there per day?
She said the average daily for immunizations is 5, right, Donna?
They're averaging about 10
About
over a
10.
5-day period.
And she's,
And I feel like they'll probably pick up once people are able to get their boosters too. I think that's gonna, I think us, yeah, I think everyone will be giving more vaccines at that point. Once we're coming up on the 6 months of the Pfizer, of those people who can get the booster dose.
Are the boosters in?
do you
Oh,
have,
yes, sir, it's the same it's the same vaccine.
yeah, it's the same.
Have to qualify, yeah. You have to have certain conditions to be able to get the booster.
So Eli mentioned is there trouble with the Moderna vaccine? Is it supply?
We're having ours is expiring this month, and we've got some that they told us to keep in quarantine and see if they're gonna extend the expiration. But they won't they have, the dose. Usually we have to go in and get it from somewhere else, and the last shipment we actually got from the hospital. And so they've always been real good, Claire over in the pharmacy. She gives us vaccine, and we're gonna need some Moderna before the end of this month is out. Yeah, but hopefully we'll be able to get it. They have what they call a marketplace that you can go in and look, and it has Pfizer, Moderna, and J&J where people have over allotment and they're trying to get rid of it.
Yeah.
Unfortunately, it means you have to travel somewhere to go get it. So if the hospital has it, it's always a better option for us than traveling to Harnett County and I've actually went to Lee County and picked some up, and that was from them. So yeah, it's out there, but it's not as readily available as it has been.
So who's going to be eligible in the end for Moderna and who's going to be eligible in the end for Moderna and Johnson & Johnson?
Well, and a lot of people don't realize this, but people who are immunocompromised or say they're chemo or have cancer or HIV, they're actually eligible 28 days after their second dose for Moderna or Pfizer as a third dose. But the other population for the Pfizer right now is 65 and older. Basically, any medical condition, that even means you used to be a smoker or you're obese. So that covers a lot of people. I will assume that the guidelines for those, I don't know if J&J will actually have a booster dose, to be quite honest. That I haven't heard that. But Moderna is definitely working on trying to get theirs pushed through, and I think the guidelines will probably be very similar to Pfizer, but a lot of that, just like with the pediatric vaccine that's coming out, they're preparing for that, for the Pfizer, but you don't know until they approve it what the final guidelines are on it. But yeah, hopefully Moderna will come out pretty soon, just like Pfizer has. But I think it'll probably be about the same.
Is there going to be an issue with anyone who's employed in healthcare that's under the age of 65 getting a booster for Moderna that you're aware of?
I don't think so, because it does, the guidelines that I've read, the preliminary is that working in a healthcare setting.
Okay. I've had several people ask me about that just recently because they had the Moderna and they wondered about getting the booster since they were under 65. I didn't think there would be an issue, but I did want to ask about that.
Yeah.
Okay. Does anybody have any questions for Donna? We thank you for all you're doing. Y'all are doing a great job down at the American Legion.
If there is any vaccine giving as booster, which would be number 3 vaccine. Hello?
I missed
Yes,
some.
it would be a third. I think, is that your question? Is it a third vaccine? Is it what's right?
Yeah, exactly. I don't know if you guys, I'm in a screen that say on the bottom, Toshiba, this is Dr. David. And I heard this on the news, and I heard it on the 6 o'clock news, and they say communities started to giving third vaccine, which they call booster. So if this is the case in our county or not?
Yes, we have it available for those who qualify.
Okay.
Yes, sir.
Any other questions about the monthly activity report? Has everyone had a chance to go through it? Thank you so much, Donna. We appreciate that. Does anyone have any questions for anybody else who's on about the activity report?
No.
We thank you all for putting that together for us. Thank you for your hard work. So the monthly activity report includes all the department reports as well. Do we need to accept these? No? Okay. So, we'll move on to unfinished business if there are any, if there are not any additional questions. So, Eli, did you want to discuss the COVID vaccine requirement policy that's on here? Did you want to discuss that tonight?
I think the policy was sent, so my assumption is that every board member has the opportunity to review it. If there are questions about the policy, then we can probably discuss it.
So I think that you have a copy in your packet. It was discussed, I think, last meeting. So, I do have a question. So, as far as a mandate for vaccines, is the mandate, are we looking at a mandate because it falls under the CMS requirement that if you receive funds from CMS, that if you have more than 100 employees, you're mandated to have everyone vaccinated? Is that where that falls?
So we are looking at that, and we are also, I think, considering from the local perspective or from the state perspective as to what can you do when you have too many some of your employees who are out because of COVID and have been out twice or more than twice because of COVID-related problem. So it could form a CMS, and it could also form another local ordinance to say that we can implement a policy that will require somebody to prove a leadership vaccine.
I don't want to continue to say anything, but I was going to ask her concerning Colin Powell and his situation. Is it affecting us in it way at all as far as what we might feel, what's going on, going in different directions concerning that?
Consider from COVID complications?
And I was wondering how it's affecting us in it at all.
Well, General Powell was 85, and I think that's an independent risk factor alone for COVID complications. He also had cancer, so he was immunocompromised, and he had Parkinson's disease as well. So all those things combined contributed to those COVID complications just based on his comorbidities, his other conditions, is my understanding.
Yeah, I'll just ask.
I think he died with COVID instead of from COVID.
And that's essentially true. I would think that's essentially the way it was. He, because of the immunocompromisation due to the cancer, he was very, very, very high risk for complications from the COVID virus. I think he had probably done everything he could for a while, and, it's just that the complications, with him being so immunocompromised from the cancer, I think really affected him. Would you agree with that, Dr. Carter?
I don't really know all the details of this thing. I don't know when he was vaccinated.
Yeah.
He was vaccinated.
Yeah.
He was fully vaccinated and he was
Yeah.
following all the protocols and,
Yeah.
there was a guy had a car wreck. Or was in a car wreck and they counted him and he happened to have COVID, but he got killed in the crash. So they put him down as a COVID death because he had COVID. It's a serious threat to us all, but still, it seems like they're trying to stretch things beyond reality.
From time to time, you would wonder that, because the cause of death should be the cause of death. Whether it was whatever happened in the car accident if that's the primary cause, that should be it. But I think for him, primarily, he was so immunocompromised. That would be my thought, and I don't know none of us know for sure. So we're speculating, but that would be my thought.
Yeah.
Just the immunocompromised from the cancer, I think would have been enough to,
Yes.
to cause, and the COVID might have actually wound up, actually being the total cause of death. We don't know, but,
No.
that's my thought, just listening to the news. So, as far as this mandate for vaccination at the health department, does anybody have any comment or would like to comment on it?
Just a procedural question. Does this require a motion? Or is this
Well,
a proposed policy or is this just?
It was a proposed policy and it was unfinished business. We just looked at, it was presented and we just looked at it and we put it off till this meeting.
Table.
Yes.
I'm not a parliamentarian, but does that require a motion to bring it off the table or what's the?
We could have a motion to bring it off the table if everyone would feel better about that. Do we have a motion to bring this back for discussion?
I tell you, we're caught between a rock and a hard place. With the federal government saying everybody with, 100 more employees, which would include Scotland County, doesn't really require that we do anything.
I'm not, to be clear, I'm not aware that policy is actually enforced. It's just proposed.
Well,
Yeah.
I thought it was a law, or not the law, but a presidential mandate. Of course, the law is that portion of the statutes that a jurisdiction chooses to enforce. So if Scotland County wants to enforce it, that's up to the commissioners. We can only recommend, or just recommend it. I'd say let's table this for another meeting and talk about it again in December. But you had an interesting email today. I couldn't open your attachment for some reason, but could you kind of paraphrase?
Well, I think it's, the article, I have the article, I'll give it to you, you take it home and read it. Seems to summarize as well as anything that the people that are not taking the vaccine, the people opposed to it the most are the people with PhDs. And the voluntary reports of deaths and other complications of the vaccine, of these things that we're calling vaccines, far exceed reports of death and complications from any vaccine in the last 20 years. In fact, it's thousands of times more. And they suggest that there's a capture rate of maybe 90%. I mean, underestimation by about 90%. I think the science is changing. We don't know if we're observing antibody-dependent enhancement, that actually the antibodies, when they begin to wane, actually make the disease state worse. There may be a question of that. We know that countries like, there are many countries that have abandoned the Moderna vaccine completely based on the cardiac risk. I just don't think it's absolutely clear that they're as safe as we say they are. And I would oppose any mandate for vaccination. That's my, whether it comes up this meeting or the next meeting or any other time. In Norway, Denmark, and Sweden, they just stopped all that stuff. Iceland stopped all the masking, all the distancing. Report out today the 6-foot distancing requirement was just made up. There's no science behind that either. The profits for Pfizer and Moderna are $93 billion. The federal government has bought 65 million doses to give to children. Over my dead body will they vaccinate my grandchildren. I think it's just, the data is so muddled and so unclear.
Yeah.
We have a pandemic of the untreated, not of the unvaccinated. The rate of rise of the vaccinated patients getting COVID is much faster than the rise in the unvaccinated population. I just don't think the science is clear yet, and there's not a FDA-approved vaccine available in the United States. This new one from Pfizer BioNTech, or whatever the name of that company is, not available in the United States. It's the only one that's approved by the FDA. So I just think it's
Well, I looked up the statistic worldwide, and Sweden, who's not done anything at all, has 1,472 deaths per 100,000 so far. And the United States, it has 2181 per 100,000. Peru has 5991 per 100,000. But I don't know what Peru's doing, if anything. Mexico's about the same as the United States, and Switzerland's about half of what we are. And Japan's way down. They were carrying on the other day like it was the end of the world in Japan, but their rate's 143 per 100,000. You know, one minute I think one thing, one minute the next. Of course, I'm like you, I've had both the doses, and you know, you catch it tonight, catch it here at the meeting, and go to bed, and before daylight, be halfway down the low road to Dugout Valley. Just, you know.
To me, it
If
seems
the government
like-
hadn't spent the last 160 years lying to people about everything,
That's what I want to say.
you know, it might be easier to put something through.
It seems like it's a big question mark on everything.
So, Mr. Rowley, do you want to make a motion that this be tabled to the next meeting?
Yes, I so do.
Will anybody second that?
I was just gonna interrupt before the
Okay, go ahead.
motion go on. For the sake of this meeting here and for the sake of the public, I know I came here, and I thank you all for the job you offer me. I appreciate it. But, you know, when I said this job was to protect, prevent, and promote the health of this country here. I went ahead and read this article from Dr. Thomas Seller, which was forwarded by Dr. Carter. And I just want to say that I do apologize for my ignorance or my lack of experience, but this document here is not accurate. I studied this. I studied this very clearly, and the history is gonna set this record, and I want to set this record straight. I don't think if any member of the board should be presenting information to discourage other member of the board that is inaccurate. I read author of I read author of this unpublished article here, and I also look at data from Iceland, from Denmark, from Finland, from Sweden, and from the United States. So, with all due respect, it is not right to send out misinformation or disinformation to convince the rest of the board member. If I have to lose my job at the end of the probation, then I'll just take my family and go. I'm gonna do the right thing here. When you look at this email from one of the board members, the FDA, the CDC, and the World Health Organizations are corrupt, according to what the board members wrote. And I'm not quite sure if that is accurate. So
I think, Eli, that I'm entitled to that opinion as a free American. I'm entitled to that opinion, and there's plenty of evidence for those things. Okay.
right. So I'm just trying to set the record straight to rebut about this email that was sent out. Now, if you look, I went and did a research on the same articles that was sent out, and this is one of them. That why you should not use ivermectin to treat COVID-19. And I think this was represented from one of the board members that ivermectin should be used to treat COVID-19. I know everyone is entitled to their opinion, but this is not accurate. The FDA has strongly discouraged the use of ivermectin to treat COVID because ivermectin was developed to treat parasite in animal. It's not a viral drug, it is a parasitic drug. So FDA strongly discouraged the member of the society to use this drug because it is used in animal. Now, here's another thing. It says some European countries suspend Moderna shot for those 30 years and under. This was also from this same article here. This is not fully accurate. I'm just because my marks is when you read the content of this article, it's completely different than what is in here. What this person is suggesting. So what this person is suggesting, when you analyze it, it's entirely from a political perspective than from a medical or scientific perspective. That is the problem. And the member of this person comes from the American Thinker, which is a political conservative group that unpublished magazines. These are not scientific based. These are not reviewed. This is a magazine. So, and this is an opinion. So, I don't want the board members to go home and with the feeling that ivermectin should be used to treat COVID. And another thing I'm looking at here is I think one of the board members also suggests that, from this same article that was shared, that Iceland had used a Moderna COVID vaccine % over heart inflammation. Now, if you look at the data for Iceland, the percent of people that have gotten the vaccine from Iceland, it's about 81% fully vaccinated, and they use Moderna and Pfizer vaccine. Now, 90% of the population in Iceland is not vaccinated. If you look at Denmark, about 76% of Denmark population is vaccinated with Moderna and Pfizer vaccine. It's the same with Finland. The United States is about 56%, which is 44% of the population is not vaccinated. So again, this unpublished, unreviewed article is not accurate. If the board can adopt this rule, that's fine. If the board cannot adopt this rule, that's fine. But I'm going to stand here and defend FDA, WHO, and CDC. Thank you.
Dr. Caldwell, you're making my point exactly. That this is not settled science. And just because the FDA says it, doesn't mean it's based in science either. just because the CDC goes against their advisory board and makes a proclamation. That, most of the people there's two different issues, two totally different issues. The vaccine safety, would you agree with me that the reports in the VAERS systems have skyrocketed to a level never before seen in the VAERS database for deaths and complications? We're talking about the vaccine safety. That's a separate issue. The vaccines are experimental things. You're not asking anything about this policy does not address how we might treat COVID. You want to go from vaccine because you think we should not use ivermectin, that's fine, you're entitled to that opinion. Then we should vaccinate everyone. There's many errors being made, in my opinion. It's based on scientific study myself. I think the use of remdesivir in the hospitals has probably done more harm than good. We're one of the very few countries in the world that use it. The panel of NIH advisors, there's 40 people on the panel. 9 of them have direct financial ties to the manufacturer of remdesivir, including the 3 co-chairmen. We're one of the few countries that use a $3,200 nephrotoxic medication in the hospital for people with COVID. And I submit to you that's because they're corrupt. The NIH is corrupt. Does that mean that everyone is a criminal, the NIH? No, but I think the action to support remdesivir is corrupted by dollars. And I believe that the CDC is corrupted by pharma dollars. I believe that the FDA is corrupted by big pharma dollars. So
what we're saying here is there are two differences of opinions in treatment, but we're not here to discuss treatment of COVID. That's not what we're doing.
Right.
What we're looking at right this minute, and everybody has an opinion, I agree with that. So we're not looking at treatment because we don't essentially treat at the health department. The hospital and other medical entities in the county treat. So what we're looking at is, Mr. Rayleigh has suggested that we table the vaccination mandate for health department employees until our next meeting.
I second it.
Okay. So what we're gonna do with the vaccine mandate for health department employees, we're just gonna table it until the next meeting. Because it is a mandate, and I think we need to think about that some more. I understand what you're saying about, opinions. Basically, it's a sharing of information. And, I know that we all have strong opinions about it, but, we're not in the business of treatment at the health department. We're in the business of trying to make sure the county citizens are safe. And so, basically, if county citizens want a vaccine, we're certainly providing a vaccine in the county for them if they want them. And that is their decision ultimately. And it's up to them to review the literature themselves and talk to their physician about what they think. As far as ivermectin is concerned, there are a number of pro-ivermectin personnel and people and companies locally in North Carolina. So that's a whole nother thing. If you're interested in ivermectin, I recommend you read up on it, like Dr. Carter's done, and like several people I know have done. And that's a personal opinion and a personal desire if you want to be treated that way. But we're not in the business of treating at the health department.
Well,
So-
the one thing I want to say is the reason I second that because I personally don't think we know. And how can we be deciding on something when we don't really know any of the science behind it?
That's why I think tabling the motion
It's
is the
different
right
on
thing to do
polio
as well.
vaccine.
And we can table this till the next meeting, and that'll give us, this is October, so that'll give us, almost 2 months, November and part of December, to see what's going on with the vaccine, before we try to mandate that people have to take it. The health department is under 100 employees. If it's a CMS recommendation, we're under 100 employees anyway, so it's not gonna be mandated for us, basically based on payment from the CMS, payment sources, Medicare and Medicaid. So we'll table this till the next meeting, and then we'll discuss it again and see where we go from there. So I have a first and a second. Okay, so we're gonna table it.
I think you have to vote on it, but that's okay.
Well, let's vote on it then. You're my parliamentarian, keep me straight. So is everybody in favor of tabling, the mandate for health department employees to have the vaccine? Any opposed? Okay, the motion's carried, so we will, table this till the next meeting. And that's what we'll do.
I'd just like to make a comment. Dr. Caldwell, I do not doubt your sincerity and your desire to do the best for the public. I don't think you need to doubt mine. I'm not gonna tell you that what you bring is disinformation. Don't tell me that what I bring is disinformation. I know this is not a scientifically adjudicated article, but it's written in lay terms by an internist that's practicing in the Pacific Northwest. Most of the people that I read on this stuff and listen to on this stuff, the whole FLCCC people, the ivermectin advocates, they're all liberals. They're card-carrying 100% all the way blue liberals, okay? Then there are other people that are politically on the right that have an opinion that everybody ought to get vaccinated. My concern is we mandate this experimental medication because CMS says we must. The next thing CMS says, we're not going to accredit your hospital if you resuscitate anybody over 75. We're going to not accredit your hospital if you don't allow abortions up till term. So, I mean, these mandates from the federal government can be two-sided. And I do believe that there's many corrupting influences on our government. We all know it's true, left and right. But at the bottom, it turns out to be money.
So remember that our job is to protect the citizens of the county. And as a health department, we offer the vaccine, and it's up to the citizens to decide for themselves if they want to take the vaccine. And we do not treat anybody at the health department for COVID. We're not a COVID treatment center. So any information, it's good to disseminate information and look at it. But, we have to remember what we're here for.
Madam Chair, if I can interrupt, I just want to confirm the number of oppositions. Dr. Labib, did you oppose
Tabling
to the tabling of the COVID vaccine requirement policy? Did you oppose?
I want the vaccine to be available. Who want freely to get it. Who do not want it, I want it to be available, but you do not obligate any citizen to go for it or to go against it.
Okay.
People are adults and can make decision on their own. I want the vaccine to be available, and I want people to make decision on their own, regardless to take the vaccine or oppose the vaccine. They are responsible for their own life. We have no right to obligate people to get vaccines, and we have no right to prevent people from getting the vaccine. If we are truly for public health, we make it available, and people make decisions on their own.
Okay, so Dr. Labib, we're tabling the recommendation for a mandated vaccine for health department employees until the December meeting.
I am against mandating. I am
Okay.
against mandating.
Okay, so he's for tabling it then. Any other discussion about that? So there, if you look on the agenda, there's some new business as far as requesting approval for the Afluria quadrivalent vaccine. There are prices over here, so we need to approve that. Thank you. Second, thank you. And so the next thing under new business is the agency strategic plan discussion. Eli, that's you, right?
Yeah, so I did review the strategic plan, the current strategic plan that the health department has. It's good, it looks great, there are great information in it. But because we are having the healthcare system is moving very rapidly, so I recommend that while I have reviewed other strategic plans around the county. I mean, for some of the counties, and I found one that was really interesting to me. So my suggestion to the board was, instead of having 3 to 5 years strategic plan, I think it's good to have 2 years strategic plan, because with that, with the fast moving things in the healthcare system, you can be flexible and be able to adjust to any change that can come. And you can review that strategic plan every 6 months. But I think it's important to have the strategic plan for at least for 2 years instead of over 3 to 5 years.
Any discussion?
Point of order, Madam Chairman, we didn't take a vote on the, on my motion. We had a second, but you didn't take a vote? Huh?
On the pricing of the vaccines?
Yeah.
Or whatever the vaccines? Yeah.
All in favor of accepting the pricing of the vaccines? Any opposed? Thank you, Mr. Rayland. So, I don't know if we need to vote on a 2-year strategic plan. But I tend to, and we can discuss that, I tend to agree that because things are so fluid right now and changing so rapidly, it might be a good idea to have a 2-year strategic plan and see where things go over the next 6 to 12 months. And we can always revisit that at a later date if we need a longer plan. We don't know where things are going to be basically in the next 6 months to a year. So it might be a good idea to keep that more fluid with 2 years. Is there any discussion about that? Dr. Carter, Dr. Boland? Charles? Mr. Matthews?
Is this something that will be forthcoming? You develop one, present it, or do you have to turn it into the state, or what's something you're coming up with, right?
So the health department already have one, and one of the things else I was looking at is I would like to have to set a retreat with the board of health members. So one of the things actually we do with the strategic plan is to look at the community health assessment, and then the community health improvement plan, and then the quality improvement plan as well. So there are multiple layers we can put into the strategic plan. In doing so, I would like, the way normally it's supposed to be done is the board of health members meet and have a retreat, and then select either their top 3 or 4 priorities for the county for the next 2 years with the data that the health department can present to the board of health members. So we present the data to you from our community health assessment or community health improvement or other sources, and then you review the data. For example, if you want to plan for health equity, if there is something that is significant to the county, then we can set a goal for health equity. And one other thing again, when I reviewed the data, I was looking at the STD rate. It seems to be a little bit high in Scotland compared to other areas I've seen. So if you want to have a goal to find a process to improve care delivery or to make great awareness of the STD, then you can have that. But the board of health have to have at least 3 to 4 goals that I think that we can work on, and then we can have external and internal plan and combine everything and create one strategic plan for the health department. I reviewed the current one. I think the difficult part is really trying to, it's difficult to measure the outcome. So I'm trying to streamline the process to be more easily accessible and easy to evaluate it and measure the outcome of that.
If I could just add one thing to what Dr. Eli said, the finalized strategic plan would need to be presented before the board for approval. Once we get it put together and finalized, it would need to come before the board for approval.
So you're saying you'd like to meet with the board in advance to discuss that?
Right. I mean, if the board wants to do that, that's fine. If the board decides they don't want to meet again, then we can look at the data and create a plan and present it to the board. But the way I have seen people do it, because one of the things is because the board is a rulemaking body. So the board has to have something that they think should be done for the county, and we can create a plan towards that. A point I gave, for example, health equity is one of the things that is really circulating now around the country. So if somebody we know about health equity here, or we know about infectious disease here. So if we present the data to you, and then you can look at that and do SWOT analysis and come out with either 3 or 4 bullet points. And then we in the health department internally can have our own bullet point and combine everything. When it is done, we'll bring it back to you, you review it and approve it, then we can adopt that strategic plan. And part of the reasons why I'm trying to engage with the board, because the board has a very big, you have a great authority to do so, and you are the rulemaking body. So I would like to connect and engage with the board members so they suggest what we really think in terms of, again, our stakeholders. So you look at our stakeholder perspective. How can we connect to other people? So if the board can recommend 2 or 3 things, then we can work on it and have internal and external plan and create one strategic plan for the health department.
So what you're saying is you'd like to have a retreat with the board
Right,
for a couple of hours to discuss that?
right, yes.
So, my thought is, I know that a lot of us work, and it would probably be difficult to do that. So, how do you think that we could accomplish that? I have an extended meeting to do that, maybe, at a regular board meeting? After we attend to the business?
Is this strategic plan a necessity, or is it something we're gonna do?
That's a part of our accreditation.
Yeah, it's a part of the accreditation process.
Accreditation, so, well, I ain't gonna say it.
Well, we have to have it.
Yeah, I
Stay
understand. No, people, I want you to write one up and then let's look at it.
So I will volunteer, they're not here. The hospital's got a lot of resources, they got a lot of data, and you're the boss, you're the one with the advanced degree, but use them as a resource. They got numbers and things that you got some too, but I'm sure they'd be willing to come alongside and help. I think they have to do something similar, just report to Medicaid or something,
Yeah,
taking care of the community properly.
and
or
probably
whatever.
some accreditation services, accreditation.
Probably
services.
overlapping
Yeah,
somehow.
so, would you like to hear that presented at an extended, Board of Health meeting? Would you say, would you be prepared to do that in December, or is that something you would want to bring before the board in maybe January?
I would like to have the plan in place before the end of this year, because we're looking at 2021, 22 strategic plan and evaluating 2023. So I think I'm looking at something before the end of this year. Again, if the board can meet, then that's fine. We can figure it out and create something and bring it to the board. The board can review as well.
Yeah,
That's
I think pretty much it would be, my thought would be, and I can't speak for everybody, so everybody speak up. My thought would be, it would need to be done at a board meeting unless you want to get together on a Saturday or something and spend a couple hours doing that.
I think we should probably just have an additional board meeting, not an extended one. And
To
then
discuss this.
we'll all be fresh and
That's
listen better. And maybe our minds will be working better.
So how do the rest of you feel about an additional board meeting? I know that we've had a number of extra board meetings this year. So how do the rest of you feel about that? Because this is October, so that means the additional board meeting would probably be next month in November. And we have one in December that we must have. So what do you think about that?
We can run through the reports and run through the finances pretty quickly, and perhaps go after half an hour and spend a whole hour on looking at what he thinks are the top, what they together think are the 4 top priorities, or 3 or 10 or whatever. We can discuss them and see if we move them around a little bit, or.
So maybe run through the general agenda quickly in December and try to spend an hour and maybe an hour and 15 minutes on a strategic, on you presenting the strategic plan that you have, and let us see what that looks like.
That's fine.
Do you think? Would that work? Would that work for everybody?
Charles,
would that work? So, if things do not sound satisfactory, and if there's more information needed, then we would just have to listen, we would just have to go through that in January. But I know we've had a number of extra meetings this year, so I know it's gonna be hard to try to get an extra meeting in. And this is the middle of October.
So when is the third week in December?
Do we already have a strategic plan?
For 18, your fiscal year 18 to 21, June 2021.
So we do need to update that.
Okay, so,
So the third
How does-
week, the third Tuesday in November is,
The 15th,
huh?
I'm
What'd you-
sorry, the 21st?
It is the 21st.
why don't we just take the plan we have now and change the date on it and use it again?
Mr. Rayleigh, I love you
In a
say
perfect, in a
that.
world,
Huh?
I love you saying that. That's not gonna change it. We do have to look at it and update it, just because for accreditation process, and when they come into a credit health department, they look in every little nook and cranny, I can tell you.
Yeah.
I can tell you, so there may be some things that we can tweak in there, and there are probably some things, because with a strategic plan, there's a number of things you need to carry forward. There's some things you need to add. So we could look at a few specific things, and, I think we could do that. The third Tuesday is the 21st of December. So how do you feel about that? Is everybody gonna be in town?
When,
that's
what's that
actually a
date again?
schedule.
The 21st of December, that's our next meeting.
That's our next meeting.
I suppose I'll be in town. I don't have anything planned.
I think we can, I think what could be easy, probably we can develop something, with our data and then bring it to the board. Probably
Okay,
that'll be easy,
on the
because,
21st, you think,
of December,
of December?
yes, we could be able to get something.
That's our next regular meeting,
Yeah, we
so.
can be able to get something.
Okay, so we'll plan for that then. So, I'm not sure that, this needs to be, approved. Do you think, Mr. Rayleigh, what do you think? Do you think we need to vote on doing this?
I don't know, it's always safe to go ahead and make an emotion and vote on it,
Okay.
I'm sure.
Would somebody make the motion, please?
So move.
All in favor? All opposed?
When you get your draft of this
We're gonna do
done,
that, okay.
once you made
Okay,
it out
sure.
to us, let's look at it.
And before we move that, and one of the things that we are looking at after we develop this, actually, I want the health department to get a national accreditation. So with the state and the national, but when we get a strategic plan, then we are working towards that for the health department to be nationally
Exactly.
recognized.
That's right. So the only other thing I have is just a reminder that, we will be, and this is just a general discussion from me. A chair and a vice chair have to be elected annually by the Board of Health. And the officers shall be elected to serve for 1 year or until their successors are elected. So that we will actually be voting on a new board chair and vice chair at the January meeting. So there will be a couple of you nominated to be a nominating committee to select and choose and coerce someone into being the board chair and vice chair next year. So if anybody wants to, if anyone thinks that they're interested in that, they can certainly volunteer and talk to whoever the nominating members are that will hold that meeting.
I'll make a motion that we table any discussion of new board chair, and if there's not a new one, then you have to be it forever. That's what you just said.
According to this Article 4, we have to do this. We have to do this. It is mandated. It is mandated, and therefore we will do this in December and January. In January, as soon as the board chair is elected, they will take over the January meeting. And Dr. Carter, you can volunteer to do that, to whoever the nominating committee is. Or Mr. Rayleigh, you can do that as well. So we have several good candidates. We have, actually, all the board members are good candidates to do this. So just so you know, that's an upcoming thing. We don't have to vote on that or anything because it's not anything set in stone. Any other informal discussion? I would invite you to go by the American Legion if you have not been and see what everyone is doing down there. It's a fabulous operation. Donna and her team do a great job. They are, I can't tell you what an asset they are to Scotland County. So go by and see what they're doing and give them a pat on the back because, you know, when we do something that's hard like this and you're in a place all day long and you're answering questions and you're giving vaccines and you're testing, you need a pat on the back. So go by and say hello and thank them for what they're doing. Okay?
Move to adjourn.
Does everybody agree with that? Yes or no?
Sure.
Okay, let's go.
Thomas just had to make that motion. I guess not.
I have a motion. Do I have a motion to adjourn? I have you. Does everybody agree? Yes? No? You're all in favor?
Aye.
Y'all all want to go home, right? Okay. All right, we're adjourned. Thank you for your time. And thank you for the discussion. Very interesting.
This conference is no longer being recorded.
Okay. So Dr. Porter, I have something interesting to share with you. So if you'll, where'd you park up front?
Yeah, top secret, okay.
And I just have something to share with you from,
Just,
from Dr.
all of
Porter.
us fell to the middle at work right now.
Are you sit out of town or do you?
You know what's happening where the numbers are.
Thank you, Sharon, for your help. And thank you for updating us all, and getting us on safe too.
My contract on the
Great.
deal only was, but if I just brought in.
The rates are way down.
6 or 7 hours.
In general.